Hi, I'm Katie Meyer, and I'm your Montana HOSA State Director, and I'm here at the Billings Career Center inside our CNA simulation lab, teaching you some CNA skills today, as well as some of the home health aid ones. So this video is on taking an apical pulse, which is skill 2 for a home health aid. And I just want to show you this space of these mannequins, because it's what we're shifting to, is moving away from using hotel space to using some of our college campuses, our career center type campuses, where you can have access to working on mannequins like this for some of your skills as appropriate, having actual hospital beds that you can raise and lower the sides and get the true piece of these skills. So for this apical pulse, this is not the best mannequin for this because he does not simulate pulses. So at the state conference, we might be able to have actual nursing students be your patients. So it might be a mannequin sometimes. It might be mannequins that are really tech savvy and are able to blink and do some of that. The college campuses, as well as our career center, actually have access to some of those types of mannequins, or it might be a live patient. So just be prepared for kind of any of those scenarios. This one would probably work best with a live patient, just so you kind of get used to working with people and knowing what that's going to look like. And so the way that I'm going to start this one is I'm going to gather my equipment, step 1, which is going to be a stethoscope. I need a wristwatch with a second hand on it. I'm going to have some alcohol wipes for cleaning things, and I'm going to have a daily record sheet. So you're going to have a record sheet from Montana HOSA. When you get the scenario, it'll tell you about your patient and what you're asked to do, and they'll give you a place to record that information. So I'm going to use hand sanitizer or wash my hands depending on what's set up in that room. So I'm going to make sure that I do that step on there, and I'm going to talk to my patient a little bit and let him know, hey, I'm here to take an apical pulse. The steps on here don't talk about this, but in an ideal world, it's best to be able to get this with your patient sitting up. So in Montana HOSA, we probably wouldn't make you move your patient because that's not in the step sheet, but just know that it's best when my patient's sitting up. So if in real life, I'd maybe want to explain to him that I'm going to raise his bed up for a second so that I can get this thing in here. And then I'm going to clean my stethoscope with my alcohol wipes, making sure to clean the earpieces, good. Clean the diaphragm off, get it all ready, okay? I'm going to place the stethoscope inside my ears. Make sure you know the correct direction to go these in. It's kind of counterintuitive. They face forward. And what we'll probably have at the state conference for you is a double-headed stethoscope. The reason being is we want to make sure that you're actually getting the right number. And the only way to confirm that, unless we're using a simulated mannequin where I am able to control that on the computer dial, with a live patient, I want to make sure that what you're hearing is accurate. So it might be a double-headed one. So you would go ahead and work the diaphragm, and then you're being able to put those in your ears with the judges. So just kind of be aware that that might be something that happens during this one. And then I'm going to, as I place that in my ears, and I don't want to do that just yet so that I'm not banging this around, I'm going to need to expose his chest a little bit to be able to see. And where you're going to feel this is you're going to look for that mid-clavicular line. So remember, your clavicle here is your collarbone. And so midway through that, and then I'm going to come down to about the 5th intercostal. So that's that intercostal muscles are between your ribs, costal meaning ribs. So I'm going to come about right down, kind of around that nipple line is where I want to be listening to the top of the heart there, that apex of the heart, which is why we call it an apical pulse. Okay, so I'm going to go ahead and get these in properly and place my stethoscope there. And then watch on my timer. The first lub-dub that I hear is the first one that I'm going to count. So I'm going to listen for lub-dub, and each of that is 1 count. So I'm going to listen for a full 30 seconds. For a full minute. Remove this from my ears. I'm going to then wash my hands or use the hand sanitizer again. And I'm going to accurately record that on my sheet. The judge isn't going to tell you you're right or wrong, but you're going to receive those 3 points if you're able to record within 2 beats of the judge. So plus or minus 2 beats of what your judge heard with either the double-headed stethoscope or ahead of time, or if we set that dial, that's where you're going to get those points. And then you're also going to get points for properly communicating with your patient, maybe properly communicating with the support staff that assigned you to that drill in the scenario, and practicing proper safety precautions throughout the drill. So your hand sanitizer, and all that kind of thing as you go through there. So that is skill 2 for home health aid.